Hi, I am Dr. Saqib Mansoor, and today we'll discuss body planes and the sections with four body planes: the median plane, the sagittal plane, the frontal plane, and the transverse plane. So they're, made in relation to the anatomical position. So the detail of the anatomical position recapitulated. Anatomical position denotes body position as if person was standing upright with head, the eyes, gaze, and toes directed forwards anteriorly. This is the head and the gaze anteriorly, and these are the toes directed anteriorly, and the arms. These are adjacent to the sides with palms facing anteriorly. Here you follow the laser, the palms anteriorly, and the lower limbs placed close together with feet parallel. You could see this is the feet parallel and lower limbs close to each other. So the body planes, so four of them. Four imaginary planes are used for anatomical descriptions that intersect the body in anatomical position. So these four planes I told you already, these are the median, sagittal, frontal, and the transverse. You could see this as well again. Now we'll discuss one by one all these four planes. But it's the first of all, it's the median plane, the median sagittal plane. This is a median plane, right? And it's the vertical plane that passes longitudinally through the body and divides body into right and left halves, right? This is the median. And this is one half, the right half, and the other part is the left half. This is the median plane, right? This plane defines the midline of the head, neck, and trunk where it intersects the surface of the body, right? So this is the way with it. This is the midline of the head, neck, and trunk. Here you could see it is going down. Midline is often wrongly used as a synonym for a median plane. Now, the sagittal planes. Here you could see this is the picture of a sagittal plane. These are the vertical planes that pass through the body parallel to the median plane. This is the median plane, and all the planes passing parallel to the median plane are the sagittal planes. Parasagittal is usually used but is needless because any plane that is parallel to and on either side of median plane is sagittal by definition, right? So needless to say parasagittal. Nonetheless, a plane lying parallel and nearer to the median plane can be called a paramedian plane. And now very important, frontal or the coronal plane. These are vertical planes that pass through the body at right angles to the median plane, dividing the body into anterior and posterior parts. This is the frontal or the coronal plane, right? See its disposition that it divides the body into anterior and a posterior part, right? And they pass through the body at right angles to the median plane. And this is the transverse planes. These are, you could see this picture, right? This is the transverse plane. These are the horizontal planes that pass through the body at right angles to the frontal and the median planes, thus dividing the body into upper, the superior part, and the lower parts. Right? This is the transverse plane. Radiologists term transverse planes as transaxial, which is usually shortened to axial planes. These are also known as the axial planes. It's transverse plane, right? Now the sections. That could be longitudinal sections. You could see like this, and the transverse section like this, and the oblique section. So let's discuss in detail one by one. The sections is number of frontal, sagittal, and transverse planes is limitless. A reference point, commonly a palpable or visible landmark or vertebral level, is essential to identify location or level of the plane, like a transverse plane through the umbilicus. This is the transverse plane passing through the umbilicus. This is the umbilicus at the T10 level. And the section of the head, neck, and trunk in precise transverse and frontal planes are symmetrical, passing through both right and left members of the paired structures, allowing some comparison. The sections continue. First of all, the chief use of anatomical planes is description of sections, right? So very important. Be that it's an anatomical section and a radiological section by CT scan, etc. Longitudinal sections run parallel to or lengthwise the long axis of the body or of any of its parts, in term applies regardless of the position of the body. Here you could see this is the longitudinal section, and with this we can open up the structure and study it like this. Though median, sagittal, and frontal planes are standard, most usually used, longitudinal sections, there is a 180-degree range of possible longitudinal sections. Now the transverse sections. So easy peasy. Transverse sections, cross sections, slices of the body or its parts which are cut at right angles to the longitudinal axis of the body or of any of its parts. Here you could see this. This is a longitudinal axis. It will study all the layers of the structures present at that level, the transverse section. As the long axis of the foot runs horizontally, right? You know that this is the long axis of the foot. A transverse section of the foot lies in the frontal plane. This is the frontal plane of the foot, right? If we draw a section here, this is the way with it. This is a transverse section of the foot lies in the frontal plane. Here you could see this. And the oblique sections, very, very important, are slices of the body or any of its parts which are not cut along previously listed anatomical planes. In practice, several radiographic images and anatomical sections do not lie exactly in the sagittal, frontal, or transverse planes. Frequently, they are slightly oblique. So the last slide, the sections, anatomists create sections of the body and its parts anatomically, and the clinicians create them by planar imaging technologies like computerized tomography to describe and display the internal structures. So thank you very much. This was the second lecture of the general anatomy.